Hi, my name is Jen Kaiser, and I'm an assistant professor in obstetrics and gynecology in the Division of Family Planning here at the University of Utah.
And I'm Alyson Shinn, a chief resident in obstetrics and gynecology at the University of Utah.
Together, we are going to present our project titled Assessing Residents' Adolescent Sexual and Reproductive Health Knowledge, Confidence, and Self-Efficacy, a novel simulated patient workshop.
As a resident, I've experienced firsthand a lack of high-risk teen behavioral training, particularly in sexual and reproductive health. We know from prior research that simulated patient encounters help improve physician self-efficacy, which in turn correlates with higher rates of screening on a variety of topics. However, simulated patient encounters are not routinely used in resident training or with adolescent actors. In our study, we aim to evaluate changes in resident adolescent sexual health counseling self-efficacy, counseling confidence, and knowledge after participating in an adolescent-led simulated patient workshop.
We designed a prospective pilot study to address these aims. We recruited OBGYN, family practice, pediatrics, and emergency medicine residents to participate in an adolescent-led simulated patient workshop. Our teen actors were volunteers from the Planned Parenthood Association of Utah's Teen Council program. The teens created their own unique patient scenarios, ranging from STD testing to a missed period. The teens also gave a best practices presentation to resident participants on adolescent sexual and reproductive health. This is based on the Adolescent Healthcare Communication Project. We had resident participants complete a pre- and immediate post-workshop survey, and our primary outcome was change in counseling self-efficacy and confidence. Each simulated encounter lasted 15 minutes and included direct feedback from the teen actor.
We had 16 resident participants complete the workshop, 75% of which were OBGYN residents. As this was a pilot study, we cannot claim statistical significance of our primary outcome, but we did see a rise in self-efficacy and confidence scores after the workshop. This can be seen in figures 2 and 3, where blue is pre-workshop and orange is post. Areas of improved self-efficacy included counseling on safe sex practices, contraception options, and pregnancy. Improvements in counseling confidence were seen in determining sexual risk status, taking a sexual history, discussing sexuality, and reviewing safe sex practices, contraception options, and unintended pregnancy. Additionally, residents showed improvement in adolescent sexual health knowledge scores after the workshop.
In conclusion, we saw improved counseling self-efficacy, confidence, and adolescent sexual and reproductive health knowledge immediately following the workshop. Although this was a small pilot study with a majority of OBGYN resident participants, we are still very excited by these results. This novel workshop using adolescent actors is now being offered to the Salt Lake City community in conjunction with the Teen Council to continue to improve adolescent sexual and reproductive health care.
Hello, my name is Ocean Candler, and I am a community health educator through Planned Parenthood Association of Utah. I am a Teen Council facilitator, which is a peer-led sex education program, and I am also the facilitator for the Adolescent Healthcare Communication Project that Dr. Kaiser mentioned before. This project is a teen-led training for healthcare providers. They are trained to facilitate a presentation called Keeping It Real with Your Patients. After the presentation, providers have the opportunity to participate in role plays with teens where they get active feedback afterwards. This training gives providers time to ask questions, think about their own biases, and set goals to improve their connection with teen patients. Our next training is May 21st from 5:30 to 7:30 Mountain Standard Time. If you are interested at all in this training, please email me at education@ppau.org. Looking forward to seeing some of you.